Guys, we're gonna go for the second video. Okay, this is the second case, and remember the first time how we did it is a 45 year old man, and now the symptoms: chronic arthritis. Okay, and I'm gonna show you what I'm doing. So 45-year-old man, and he has chronic arthritis. Then we go back and we see, okay, chronic arthritis in the lower back, hips and knees. This is important. Lower back, hips and knees. Okay, so we write it just quick in here. Lower back, hips and knees. We go back and we say on physical examination. This is the other important arrow. We say really quick, on physical examination, the square appears to have brown discoloration. This is important. So the sclerum has brown discoloration. Brown discoloration. That's it. And then we go back and we keep on reading. Discoloration. However, his vision is unchanged. His cartilage is similarly discolored. An X-ray of the spine reveals this degeneration and dense calcification that is most prominent in the lumbar region. Okay, so we say, okay, in the lumbar region, we have degenerative disease, and we have dense calcification. Okay, right here. So you see what I'm doing. Dense calcification. Okay. So we go back and we look for more things. An X-ray appears normal at first, but begins to darken with time. No, that's the urine. Sorry about that. His urine appears normal first, but then begins to darken. Okay. So urine darkens with time. Okay. The first question: what is the most likely diagnosis? So we know now what to look for, the bad things, what we see, with the symptoms first, and then what we see, and then the age and the sex. And then they ask us diagnosis. Okay? So when we think about it, we think about darkened urine. Oh my gosh, this is Alkaptonuria. We'll write it down. Okay? Alkaptonuria. Very good. Now they ask us, what is the biochemical defect in this condition? Just remember this and pause it for a while, okay? So, what is the biochemical defect? So there is an absence of homogentisate oxidase, and you write it down. There's a defect in homogentisate oxidase. Alright? And then an enzyme in the tyrosine degradation pathway. And the accumulation of homogentisate in the cartilage. So that's, as a result, we have homogentisate in the cartilage. And it leads to arthritis and the coloration of the sclera and other body tissues. We'll write it down. Homogentisate in cartilage. A lot of homogentisate in cartilage, which give us the coloration. Now, the other question. The metabolite that accumulates in this condition is derived from which essential amino acid? And then we think and we say, okay, it's a metabolite of phenylalanine, all right? Phenylalanine. We'll write it down. Amino acid. Oh, homogentisate. Is a metabolite of the amino acid. Okay, phenylalanine. And if we remember that, Alkaptonuria cycle, that's it. It says that further metabolizes to acetate and fumarate, part of the carboxylic acid cycle. Now we go to another question. This is another one. Given the extent of joint disease in this patient, how might his mental functioning be affected? And this is important because Alkaptonuria has no effects on cognitive functioning. Aside from its effect on joints and discoloration of the sclera and skin, the disease is benign, which is good news for us. So what is the treatment for the condition? There are no ways to prevent the buildup of homogentisate. Dietary restrictions of tyrosine and phenylalanine reduces the production of homogentisate. But this approach has demonstrated no benefit on the overall condition. Treating the symptoms of the patient's arthritis is the only recommended therapy in this case. So what is the treatment for this condition? Treatment. Just treat the symptoms. Treat the symptoms. Okay? Now the other question. Which amino acids are exclusively ketogenic and which amino acids are glucogenic? And this is important, guys. So leucine and lysine are the only purely ketogenic amino acids. All right? This is just memorizing. Leucine and lysine purely ketogenic. Phenylalanine, threonine, tryptophan, and tyrosine are both ketogenic and glucogenic. Okay, so this is ketogenic, we said, right? Leucine and lysine. And now we talk about ketogenic, ketogenic, and glucogenic. And those are isoleucine, phenylalanine, tryptophan, threonine, and tyrosine. And then they say which one is glucogenic. We have to figure that out. So it's not, leucine is not there, right? And lysine is not there. So everything but leucine and lysine. All right? So leucine, phenylalanine, tryptophan, threonine, and tyrosine. And glucogenic, the remaining amino acids are just glucogenic. So the important thing is that ketogenic are degraded into acetyl-CoA. Ketogenic acetyl-CoA degradation and ketogenic and glucogenic can be converted into glucose through gluconeogenesis. So all those things that we said are very important. Okay? So the ketogenic gave us energy. From here we get ketones and acetoacetate. Okay, the ketones need to make sense of what we are doing. Ketones. And from glucogenic, from the glucogenic ones, we get glucose. Ketogenic and glucogenic. All right? Those are very important. From both, we get energy and glucose. and the ketones. Alright? That's it, guys, for now.